routine tests for hypertension patients. Peace be upon you, and God's mercy and blessings. This is Dr. Mohammed Yusuf Kura, specialist in internal medicine and emergency medicine. A lot of patients. When hypertension patients come to the clinic and we ask them, have you done, or when was the last time you did, routine tests for high blood pressure, they get surprised. Doctor, does high blood pressure need tests? What we know is that blood pressure is just measured with a blood pressure monitor, and that's it. And we measure it at home, thinking that there are no tests or routine tests for hypertension patients. But in reality, no, there are tests, and these tests are very important to monitor the effect of the medication and the type of medication we're using, the dosage of the medication we're taking, and also it shows us the progression of the disease compared to before. The most important tests. We'll go through them one by one, just like we did before with diabetes, and we'll start with a complete blood count. The truth is, when you look at hemoglobin, sometimes it's very high. The normal range for men, for example, is from 14 to 16, and for women, from 12 to 15. For example, we find that men are 19, 18, 20, or more. This is actually a disease we call polycythemia. It will be done. Okay, which is that the bone marrow produces too many red blood cells. Therefore, the hemoglobin number will be high. Some people think this is the opposite of anemia. This is a good thing, but really no, because this means one of two things. Either there is a lack of oxygen in the blood, so the body compensates for this by producing a lot of hemoglobin, or there is a problem in the bone marrow itself that makes it produce more and more red blood cells. How do we tell the difference between them? It's actually very simple. If we also look at the platelets and the white blood cells, if we find that all three are elevated, and elevated in an unusually high way, this makes us more suspicious that the problem is in the bone marrow, and we refer the patient to a hematology consultant, and sometimes they need to take a bone marrow sample to see what the issue is. But if we find that only the hemoglobin is elevated, while the platelets are normal or just slightly elevated, it's something simple, and the white blood cells are normal. This is likely an issue of oxygen deficiency. Doctor, what problem is this for a patient with high blood pressure? It's a big problem. First, high hemoglobin means the ratio of red blood cells is high. That means the blood is more viscous. That means they're more at risk for clots. That's number one. Number two, the platelets. Same thing. Platelets have a normal range, usually from 150 to 450, depending on the lab you're using. If we find 600, that's okay, but more than 800, that's more than double. At that point, it becomes a disease, period. And this disease also puts us at risk for clots, which is extremely dangerous for someone with high blood pressure. We have to look for the cause and treat it. White blood cells don't really play a big role when it comes to blood pressure. That's for the blood count. So what else? We have kidney function tests. We've taught before and said that impaired kidney function or kidney problems can raise blood pressure. So we need to keep monitoring kidney function. So what are the kidney function tests that we monitor? There are three things. The first is creatinine, which we're all familiar with. Alright, the second thing is also protein in the urine, just like with diabetes. And even though high blood pressure itself doesn't really cause protein in the urine, but if protein appears in the urine during a routine check, that makes us suspect there might be a problem with kidney function and prompts us to monitor it. The third thing is something called the glomerular filtration rate. Alright, it's called the eGFR. This tells us how well the kidneys are functioning or if there's a problem. What other functions do we check as well? Hemoglobin A1C. But what does A1C have to do with blood pressure, doctor? No, as we mentioned before, diabetes and hypertension. And we also have high cholesterol, high triglycerides, and elevated uric acid. All of these are part of something called insulin resistance, so we have to monitor all of them. So, check the hemoglobin A1C. If I have hypertension, I should monitor it regularly, and also keep track of cholesterol and triglycerides regularly. Of course, These are very important for people with high blood pressure because high cholesterol increases the risk of atherosclerosis, which in turn raises the likelihood of having high blood pressure. The third thing is uric acid. We check these things because it reflects insulin resistance. Exactly. In addition, we also check liver function to make sure there's no fatty liver. All of these are part of one syndrome, which is insulin resistance syndrome, and we generally check for it as well. What else, doctor? We also do thyroid tests. An overactive thyroid gland raises blood pressure, so it's very important that we monitor the thyroid regularly. Now, liver function isn't just about fatty liver. Also, if your blood fats are high and you're taking cholesterol medications, sometimes they raise liver enzymes. So it's also very important that we monitor liver enzymes as well. So what are the tests we need? They're pretty much the same as those for diabetes. We have the complete blood count, hemoglobin, platelets. We have urine albumin. We have kidney function tests, creatinine. We have kidney function tests, which is kidney filtration. All right. And we have liver function tests. And we have thyroid function tests. And we have HbA1c, the long-term blood sugar test. All right. And of course, we have cholesterol and triglycerides. And we have uric acid. So, doctor, just like with diabetes, should we do these tests every 3 months? No, for hypertension, we don't have to do it every 3 months. We can do it every 6 months, depending on the case, and according to the treating physician's assessment. The most important thing, is that as a hypertension patient, you must be following up with a doctor. And it's the doctor who tells you to do the regular tests, reviews those tests, so they can assess the medications you're taking and also evaluate how the disease is progressing. Thank you very much.